Every year, more than 1 in 5 New Yorkers experience symptoms related to mental disorders. The total cost of mental illness exceeds that caused by all cancers combined. 1 in 10 adults and children live with mental health challenges serious enough to affect the functioning of their families, work, and school life. Stigma and discrimination create barriers to effective care that reduce the ability to recognize problems and treat them effectively.
Our collective vision at Astor is to provide the best level of care for all children and families in our communities. And that means everything from residential care to home-based crisis intervention and preventive care, and even education services.
Many children in our communities struggle with emotional and psychological problems that make it difficult for them to experience the simple everyday pleasures of being a child. Astor is there for them.
And had it not been for Astor, I don't think we would have, honestly, I don't think we would have made it through, because they were really, really strong and supportive of everybody.
That Astor is a good place. It might at first seem like it's like confusing and you don't know what's going on with your child. I can now, I'm a lot more calmer with him, and I can understand, because before I just really was just I don't know how to do this. I'm not gonna say I fully understand how he feels, but I can kind of get the gist of it, and I can kind of talk him through things. Before I was just kind of what do I do? I kind of just stood there I don't know how to react to this. But now I can kind of just talk to him and listen, we got to go through this together. You got to, stay strong. I know it's hard to stay strong, and I know you're scared. I know you're angry. I kind of have to keep reassuring him, and I didn't know how to do that before.
Said he was here for 22 months. He did very well. After 22 months, he came home, and he was home for quite a while, and he did really well. But Astor definitely gave us a lot of skills in how to deal with a situation that we really had no clue.
Well, I think it's, if you were to take a tour of our facility, you'd say we have beautiful school. You'd say we have beautiful space for 20 kids. And then you'd say we've got a lot of work to do on the environments for the other 44 kids. So there's, could we take more kids? Probably, but we don't want to. What we want to do is fix the living space for the 44 kids who really are in environments that are not adequate. They need single bedrooms, because these kids have challenges that sometimes means they're going to be having problems with roommates, so they have needs that we can't fulfill, and a better environment would make that happen.